Thank you very much, Chair. Greetings to you, Your Excellencies, partners, advocates, colleagues, and communities across the globe who have joined us on this special event. My name is Dr. Simbarashe Mabaya. I'm a Senior Technical Advisor for Gavi, the Vaccine Alliance. As many of you might already know, Gavi, the Vaccine Alliance, helps to vaccinate almost half of the world's children against deadly and debilitating infectious diseases. Gavi's impact draws on the strengths of its co-partners, including the World Health Organization, UNICEF, the World Bank, and the Bill and Melinda Gates Foundation, as well as from other donors and implementing country governments. We play a critical role in the strengthening of primary health care, bringing us closer to the Sustainable Development Goals of universal health coverage and ensuring that no one is left behind. Gavi has been supporting hepatitis B immunization since the year 2000, and since then, up to 2022, over 705 million children have access to this life-saving vaccine through Gavi support. In July 2023, the Gavi board approved the proposal to unpause the design and launch of the vaccine programs included in the 2018 Vaccine Investment Strategy, and that includes the hepatitis B birth dose vaccine program, which had been paused due to the COVID pandemic. In coordination with our different alliance partners, the Gavi Secretariat has initiated the program design for these vaccines with the hope of launching the programs by the second quarter of 2024 and expecting first country introduction by mid-2025. To date, 33 Gavi-eligible countries are yet to introduce the hepatitis B birth dose in their national immunization schedules. Timely administration of this vaccine within 24 hours following birth is critical for it to have the maximum effect and to protect newborns from the hepatitis B vaccine virus. This vaccine presents an opportunity for integrating health services offered under the expanded program for immunization and those under the maternal, newborn, and child health services, and could facilitate a better access to this vaccine as well as access to other life-saving interventions for mothers and children, such as promotion of safer delivery within health facilities. Several challenges may hinder effective delivery and uptake of this vaccine, including the challenge of reaching approximately 20 million children born out of health facilities in Gavi-eligible countries annually. To ensure a successful rollout of this vaccine, Gavi will rely on the collective expertise across all the alliance partners and then from countries that have already introduced the vaccine. Let me conclude by reassuring all stakeholders and partners that Gavi remains committed to its mission to save lives and protect people's health by increasing equitable and sustainable use of vaccines. Thank you very much for having me.